next section is the helix. Let's first define the helix. Coming off of the earlobe at this place, it's the outer rim of the ear. In Dr. Huang's treatments, there's not a lot of work that's done on the helix, although one of the major things she does in her treatments is bleed the ears, as she described. That's done at the apex, right here. The apex, if we were going to run a line right through the center of the earlobe, it would be right here. For shoulder and neck conditions and any other problem around this region, she'll also bleed this part of the helix. One area that she does work is this section of the helix here. To do that, just support the ear from underneath and slide your probe in either direction. Let's take a look at the key structures at the helix. A great place to work the lower back is at the posterior side or the back side of the ear. Let's define the areas so we can find the correct location. We have this channel or groove or depression, and this is the body of the antihelix on the front side of the ear. As we come up this groove, we'll find another depressed area. This is the ridge of the antihelix inferior and superior crus, and will be our landmarks for what Dr. Huang calls the lumbar triangle area. So it's 3 points that make up this triangle. It's the top of the antihelix body and the antihelix inferior and superior crus. A great way to work the neck is in the posterior, the back side of the ear. So let's define the area. We got the notch right next to the antitragus, and that starts the cervical spine. So we just come around, and that is where we would be starting, and you have the cervical spine right here. Now she calls it a triangle, the cervical triangle, which looks like this. We have the large auricular nerve right here, and coming down to the depression and coming up is the triangle area. Let's take a look at the key structures at the posterior side of the ear.